I wouldn't be seeing a doctor the way I am now. I would put everything off to the very last minute until I had to go to the emergency room or to the hospital.
The Crossroads Medical Mission is a non-profit Christian ministry providing primary medical services to those in Southwest Virginia and Northeast Tennessee who are falling through the cracks of the current healthcare system. These people include the uninsured, those with poor access to medical care, and anyone needing medical care but not currently receiving it.
We really wanted to take what we had to offer, our skills, our knowledge, our access to other resources, and take it to the people who would otherwise go without.
There's a great need for healthcare services, especially for the uninsured and underinsured in our area, because one, we have such a high amount of people who are uninsured and underinsured, but also this is an area of the country that has a very high rate of multiple chronic illnesses.
Most of these folks that we're seeing have no other means of getting any medical care.
And Crossroads has really been a godsend for me. It provided me with medicines that I couldn't normally afford. They've provided me with the health care that I need to be able to survive.
The only kind of care that I could obtain before they came on the scene was just emergency room.
Without Crossroads getting me set up with the specialists that I needed, I probably wouldn't be here today.
Our ability to speak about spiritual issues with our patients freely meets a need that may not be addressed elsewhere. That's the spiritual poverty that we kind of deal with is just as important.
We don't charge for the services that we render. Sometimes we kid about people getting what they pay for, but the truth of the matter is that the services that they receive have already been paid for. They've been paid for by the donors who give of their gifts and the volunteers who give of their time and efforts. It's not free, but it is free to the patients.
So many patients just seem overwhelmed to know that anybody else cares enough, that they're going to, cover the cost of a medication that they couldn't get. And we always try to make a point to our patients when they say thank you, that it's not us, it's there's a lot of people behind the scenes.
This thing has been a blessing in a way that I'm not sure I can really quantify it or even qualify it.
It was our goal in the beginning that Crossroads would be a blessing for the patients. We're now into our second decade of doing just that. It's also been a great blessing for our volunteers who can be of service within their own communities. It's also been a great blessing for the outreach programs with whom we partner and the medical community at large. We are so grateful for our many donors, and it's our hope that they are blessed through their support.
We are providing this care as an outreach of Christ's love for us. And so we're not just delivering health care, but we're making communities stronger, better places as well.